Today, another truck driver has tested positive. That's 2 in 2 days. These cases continue to show us that the threat of Delta to South Australia is real. COVID is coming to South Australia, and we are preparing for that inevitability. We will be ready, but we are relying on all South Australians to be vaccinated. This is a timely reminder that those of us who aren't vaccinated face a significantly higher risk. Over the coming weeks, we'll be doing everything we can to make it as easy as possible for South Australians to be vaccinated, no matter where they live. More than half of South Australian adults are now fully vaccinated. You're in the minority if you haven't been. I want to stress that hundreds of appointments are available at our vaccination clinics across the state over the next few days. We've added more than 500 appointments at Wayville this weekend. Walk-ins are available at the Myer Centre, Paraka and some regional clinics. And from today, the Tailem Bend vaccination clinic for truck drivers has been expanded to the general public, so walk-ins are welcome. And I want to stress that Moderna is now available at participating pharmacies. There is no better time to be vaccinated. There is no easier time to get vaccinated. Vaccinations are key. Do it for yourself, do it for your family, do it for the community. I'll now ask Chief Public Health Officer Nicola Spurrier to give us today's update.
Thank you, Minister, and good afternoon. So again, we do have another truck driver that's tested positive in our state, and I'll give you the details. But again, as the Minister said, the best time to get vaccinated is now. You will be immune 2 weeks after your final dose. So if you have had just one dose and you've had it a couple of days ago, that doesn't give you the protection. So there's no point waiting until we have an outbreak here. Everybody needs to get on and get their vaccination now. It is so readily available now in South Australia, and there is a choice. There is Moderna, Pfizer and AstraZeneca. So really no excuses, and as the Minister said, if you haven't been vaccinated as an adult in our state, you are now amongst the minority. So we have one new case, a man in his 30s. Now, this is somebody who is Victorian. They've come into South Australia and they've now left our state, but is the requirement to be tested, and you need to have had a test within a 3-day period. And so this person was tested last evening, so the 30th, and that's come back positive today. Now, I also was told that he had a colleague in the truck with him. They came into our state, they had purchased a truck, and so they have driven separately back to Victoria. And just before coming to this press conference, obviously I was very keen to know the test for the other driver, and that's come back negative, which is really good news. Now, of course, we ask about vaccination status because it is a requirement for freight drivers to be vaccinated, and one of the drivers had had 1 dose of AstraZeneca, which is good, but the driver that's positive was not vaccinated. Now, what is our risk here in South Australia from these exposures? So fortunately, they did not spend long here in South Australia, and we have only 2 public exposure sites, and those are 2 petrol stations. So people will think this is the same story as I gave yesterday, and of course this is, I think, the 9th truck driver, and the truck drivers do need to stop and fill up for petrol and also to get some refreshments. So this time we've got the Liberty service station in Glenunga, and that was on the 1st of October at 1:59, and then the Coles Express at Tailem Bend again at Tailem Bend. So I was really keen to look at the vaccination rates of the Tailem Bend community, and I certainly urge you in Tailem Bend, you are at quite high risk given that that's a major truck route. And then so that Coles Express in Tailem Bend was the 1st of October at 3:45 a.m. So those times are obviously very early in the morning, and that means that there were very few people in at that time. My CDCB team have been looking at CCTV footage and the like, and QR check-ins, and at this stage it does not look as though we have any members of the public exposed closed during those times, but we will still list this up on our exposure on our website as exposure sites. But at the moment, it does not look as though we have particular concerns for ongoing exposures in our state. But we don't usually stop with just our initial investigation. We continue to collect information, and if there's anything else that we find of concern, we will let South Australians know. I do have an update on yesterday's case. So this was the other truck driver who's the South Australian resident, and his family are now in quarantine but were negative. Just to let people know that we've identified 56 contacts from the exposure sites. 23 of those were identified through the QR check-ins across the sites, and the remaining are either staff or people who have self-identified. And I would just like to publicly thank those people that have come forward, self-identified that they were indeed at those exposure locations, because of course that means they will need a 2-week quarantine period, and these people are doing that to protect our community in South Australia from COVID. So thank you very much from me. Also, just a note on Queensland. There is a growing number of exposure sites now in Queensland. Our team SMSs out to people who have come in from Queensland, and there are particular LGAs where we now are requiring 3 lots of testing, but we haven't put any border controls in other than that testing. But anybody who's been to any of those exposure locations will need to be in quarantine as well. And the team have told me that they've found 4 people who have been at exposure sites in Queensland. Now, our way of identifying those people is if the public look at our website, so people that have come from Queensland look at our website, fill in our survey, and then we can identify you. So I do urge people that have either South Australians or people who have come from Queensland that it is really important you follow our SMS message and check that website. And of course, one of the things I'll be doing over the long weekend is keeping track of what's happening in Queensland to determine whether we need to make any other changes. At this stage, I'm comfortable with the testing, those 3 lots of testing. So very happy to take further questions, but that's where we're up to on a Friday afternoon. 2 truck drivers positive in our state at this stage, but hopefully because of the checks and balances that we have in place, we will not see any community transmission. And also, as I said, a thank you to all of those people that have come forward and that we now have in quarantine as a result of this.
Did truck drivers breach any rules by not being vaccinated?
Yes, so indeed, obviously the person who was the co-driver has followed the instructions of being vaccinated, but it is disappointing that that person was not vaccinated. It gives you an increased risk of having the disease and then, of course, being able to pass it on to other people. This person is from Victoria. He's now back in Victoria, so there's not much we can do at this stage, and I am just hopeful that he will decide to get himself vaccinated once he's got over his illness.
Professor, are you, is SA Health liaising with SAPOL about taking further action against this truckie for being in breach of the emergency management directions?
Yeah, so as I said, he's now back in Victoria, so of course that limits our ability to follow up with that particular individual, but it is disappointing, and SAPOL does a fantastic job at checking compliance of truck drivers, but it's simply impossible to be stopping every truck and checking every truck that comes through. We've worked really closely with the freight industry. They're totally on board because it protects their workers as much as anything else, and they understand how important it is for the community. But you know, there we have it. Majority of the truck drivers that we have had positive in our state have had at least 1 vaccine, so it's just unfortunate that we've got that circumstance today.
So, sorry, Professor, how, given the fact that this gentleman appears to have breached the rules by not having a vaccination, yet he's gone back to Victoria, so no further action?
Well,
what do you say to members of the community that might find that difficult to understand, given the draconian rules that we all have to live under with COVID?
Yeah, so certainly our legislation is specific to South Australia, and so we don't have an ability to follow him up as he's now interstate. And there may indeed be rules in Victoria about mandatory vaccination for certain workers, so that will be entirely up to the Victorian Police to follow that through.
But it's fair to say he broke the law, is that correct, Tailem?
Yeah, so we required from a certain date that freight drivers had to have had at least 1 vaccine dose, and of course we've set up vaccine hubs up at Tailem Bend and Yamba specifically for truck drivers to facilitate them getting that vaccine. So, yeah, as I said, it is disappointing in this instance. The individual has caught COVID, and I do hope they recover from this, and I'm hoping that they will go on and get vaccinated.
Professor, what's therefore your message to people in South Australia? You know, you don't get vaccinated, as you obviously got higher risk of catching COVID, like has been seen. What is your message to the public? Should we be worried that these truckies are spreading COVID through South Australia?
Look, I think South Australians have to be very realistic and very pragmatic that we have got Delta in Australia. We've got it in 2 bordering jurisdictions. And at some point, we do need to have that hard border soften, and we need to make some decisions about having freer flow of movement between our jurisdictions. We can do that most safely when the majority of South Australians are vaccinated. The National Cabinet gave us the 80% target. New South Wales has already gone past that to 85% for their first dose, and once you've had 1 dose, it's very likely people will go on and get their second dose. So I'm urging every South Australian to get out and get their vaccine. It is really easy to do. There are very low risk of any serious side effects. It is absolutely the safest thing that you can be doing at this point in time. So just to reiterate what I said at the beginning, when you get your first dose of vaccine, don't think that you're covered from that day. It takes time for the vaccine to work. It takes time for your body's immune system to react to that, and it's 2 weeks after your second dose. So if you get your first Pfizer dose today, 3 weeks later you get your second dose, and then 2 weeks after that your immune system is ready to go if you come across COVID. So that's 5 weeks, and so the sooner really people get on board and get it done, the better for them.
Professor, how come interstate cricket teams have been barred from coming into South Australia, given that so much effort was put into allowing footy teams to come in? Is that a double standard?
I wouldn't have said that they're barred, but any person in Victoria and New South Wales, we're not allowing in, and it has to go through a formal exemption process and a quarantine process. Now, when we had the AFL, we were not at that high rate of disease that we're now seeing in Victoria, very high rates of community transmission. The AFL were in a bubble situation, and we flew people in, they played their match and they left. That's quite a different situation with the Sheffield Shield. And what we do have, though, is a large number of South Australian residents who, for whatever reason, are stuck in New South Wales and Victoria. And as people know, we've got a large number of those people needing to come back here. And we really need to prioritise that. And so that was the reason that we did not allow those teams to come in and undertake quarantine here, because we really do have to prioritise our own citizens.
So it is different circumstances, different times, the situation's worse now than it was?
Absolutely. It's quite different to when we were dealing with AFL. And we were feeling quite comfortable. They had low rates of disease at that time, and we were flying the players in, we were testing them here, they would play and then they'd leave. So it's quite a different situation.
Professor, have you had any details on the gentleman's test result? Did it show a strong reading? Did we catch it did we catch it at effectively the beginning of the cycle? What details?
Yeah, so I have been told that it looks like he's early in the infection, but the couple of days before you develop symptoms, and my understanding is that he doesn't have any symptoms, so we have to go from when the test was done. But it's actually a couple of days before you become positive that you are quite infectious, so it does look like he was early on, though, in the disease.
And has he been cooperating with your contact tracers?
They've certainly been able to interview him. It is difficult to do interviews with people who are driving trucks because often they're quite tired and they've been driving for a long time. They've certainly been able to get some information, but generally we do try and follow up as well, just to make sure we've got every bit of information possible.
So therefore, can we interpret your comments to say he hasn't been as cooperative as you would like?
I think the team are pretty happy that they've got a good interview from him, but as I said, we do follow up just to make sure that we've got all the details. I think it was actually very helpful to be able to talk to this gentleman's friend who was driving came over and then had the second truck and went back, just to be able to corroborate that information.
Have you had to have a need for interpreters in your interviews?
No, and we wouldn't generally provide that information, not that I've been told in this situation.
Sorry, this is now 2 truck drivers who've tested positive in 2 days. Is this something we're expecting to see more of now?
Look, I think we can all take a big sigh and say possibly yes. I'm hoping I can get through the long weekend without another truck driver coming through, but it really is a reflection of the level of disease in those 2 states. And it's good to see the numbers are starting to come down a bit now in New South Wales, and it's because their vaccination rates are really cranking up now. I'd be really hopeful that we can start to see that the peak has occurred and we start to see some numbers going down in Victoria. I'm sure Victorians are also feeling like that, but it really reflects the risk in those states at the moment.
Were they actually coming here to ship freight, or were they coming here just to buy that second truck? And if so, does that really count as a reason to be coming?
I can't tell you whether they also additionally had freight, but I do know that there was 1 truck that came in and then 2 trucks that went out.
Are you expecting any more exposure sites, Professor?
Look, this is where we've got to at the moment. We'll always be putting new exposure sites up on our website. So if you haven't got our website on, or our Facebook site as a site for you to keep checking, I advise you do. That's also in terms of the Queensland sites as well.
So at the moment, we don't think there's any close contacts with this case?
There will be close contacts who have been the attendants in the petrol station, but as far as I've got at the moment, the information I've got at the moment, it doesn't look like that anybody else was in the shop at that time.
Professor, the driver wasn't vaccinated. One of the drivers wasn't vaccinated. Is your information from your contact tracers that they followed other rules, such as wearing masks and keeping minimum contact to the public to a minimum?
Yep, exactly. So they were certainly doing that, and they were certainly just in and out of our state very briefly, and fortunately they had their testing done, so that's how we've got those results.
And just to check, the exposure sites are this morning? So 1st of October is today?
Yes. So it's the 1st of the 10th at 1:59 a.m. and 1st of the 10th at 3:45. Yeah.
What do we expect any more community transmission from this case at all, Professor, in your expert opinion?
Look, it's early days. It's hard to say. We'll be following up and having people in quarantine. I think the one risk here is that the person was not vaccinated, and so they do pose a higher risk. We know that the vaccine, not only does it protect you and reduce the symptoms in individuals, it also reduces the amount of transmission risk to other people.
Professor, given that we've had, you say, 9 truck drivers go through, and we haven't seemed to have seen any community transmission at this stage, do you think that's a reflection of, is it a combination of vaccine rates being high in our state as well as the public health measures you're putting in place?
I think it's probably more a reflection of the measures we've got in place for the freight industry. It's about the regular testing, because if we didn't have that regular testing, we wouldn't even know about it, and so the drivers themselves wouldn't know, and they could come back into our state and actually be infectious. So also, out of all of the drivers, the majority have had at least 1 dose of vaccine, so I think that's also helping. We've got very strict rules around wearing of masks and using QR codes and such like, so I think that all contributes. As our own population increases its vaccination level, that is again one of the best protections.
Professor, can I just ask you on a slightly different topic of vaccinations? Can you talk us through pop-up clinics in schools, please? What's the plans for that?
Yeah, so we're working through how well, basically at this stage, people know we've had the mass vaccination clinics, we've had GPs doing vaccines, and now we've got pharmacies on board as well. So, and in fact, initially we had our hospitals running vaccination clinics. So now we've got to this stage of our vaccine rollout, we're looking at all opportunities for pop-ups, and that's to bring the vaccine to people and make it easier for people to get vaccinated, particularly if you're a family with lots of children, for example. It might be quite difficult to get into a mass vaccination clinic. So we're looking at all opportunities, and that might include schools as well. So we're definitely looking at that. Southern Adelaide has taken their pop-up clinic into mosques, and that's been very helpful for some of those Muslim communities. But we're really looking at other opportunities, and we will have more to say on that as we are starting to roll out that phase of our vaccine campaign.
Minister, can we just have a brief word? Thank you, Professor. You opened your press conference saying that we're ready for Delta. Can we interpret that as our hospitals are ready for any surge in capacity?
Certainly, SA Health has been planning for months for the risk of an outbreak, and now we're in the National Cabinet plan planning for the shift to the post 80% vaccination rate. But this is heavily predicated on a high vaccination level. Let's remember, when New South Wales started to go into its outbreak, it only had 4% of its community double vaccinated. We've got 50%. And as we plan for coming up past the 80% rate, it is really important that people get vaccinated, because that will significantly reduce the pressure on our hospital network. As health ministers have been highlighting for months, there is significant pressure on our hospitals, both in the COVID low states and in the COVID outbreak states. We are rolling out a number of initiatives to help the hospitals deal with that pressure. We'll have more to say about more initiatives in the coming days.
Minister,
No, you go.
I was just going to say, today the PM announced international borders will open up later this year. Will we allow vaccinated South Australians to come home and do 7 days home quarantine?
Well, the Premier is shortly leaving National Cabinet, and I understand he's going to make a statement on that exact issue.
If we got Delta tomorrow and it started surging through the community, is our hospital system ready for that?
Our hospital system is ready, but let's be clear, we are not opening the borders tomorrow. We've got a very clear national roadmap to move towards 80% plus vaccination rate. South Australia has made it very clear that it is an 80% vaccination rate with good spread right across the state. We're all in this together. We want to make sure that vulnerable communities are supported to get vaccinated so that we can all be protected. Not only does it help protect you from getting the illness, it also reduces the risk of you transmitting it to others. So vaccination is the key. Vaccination is our pathway out of this pandemic.
Minister, just on that international borders opening up, what is your perspective about children with international families with young children, perhaps around the age of 5 or so, younger than available to be vaccinated at this stage? What do you think the approach might be for them if they're hoping to enter the country?
The reality is that this pandemic is becoming a pandemic of the unvaccinated. The reality is, whether a child is within the South Australian community or is part of the travelling community, they will have a risk that a vaccinated person won't have. So we are very keen to make sure that as we plan for the post 80% vaccination level, that the children are protected.
Thank you.